Good afternoon, and welcome to our Facebook Live discussion. I'm Dr. Dean Sidelinger, the Health Officer and State Epidemiologist.
Hello, and I'm Alexia Zhang, the COVID-19 Data Reporting and Analysis Program Manager. And today we're going to answer your questions about data and how we report it, how it informs our actions and guidance, and most importantly, our decision-making on how to turn back the tide of COVID-19 in Oregon. But before we do that, Dr. Sidelinger will provide a brief overview of the state of the pandemic here in Oregon.
Thanks, Lex. While we're here to talk about data today, I think we always have to remember that each of these numbers, each point on a graph, is a person, a fellow Oregonian infected with COVID-19. Some were hospitalized, some tragically have died, and many communities across our state have been impacted much harder than others. Our Black, African American, and African immigrant Oregonians, those who identify as Latinx, those hailing from the Pacific Island nations, and our Native American neighbors. After seeing a very concerning spike in cases, deaths, and hospitalizations from late October and into November, the situation has stabilized somewhat. Hospitalizations, while still high, have leveled off, and we did not see the surge in cases after Thanksgiving that we did following some of the other holidays in 2020. We saw 3 consecutive weeks of declining cases, but now we're seeing cases increase in Oregon following Christmas. We are celebrating the arrival of 2 new vaccines, and as of earlier this week, we're reporting second doses have begun for our frontline healthcare workers and support staff. But trouble still lies ahead. The percent positive tests remain stubbornly high, and last week, the positivity rate was 6.2%, higher than the previous week, and a sign that the virus still remains very active here in Oregon.
Our data indicates that COVID-19 is still disproportionately affecting our communities of color. People aged 20 to 49 account for 54% of COVID-19 cases, while people 70 and older have accounted for 77% of deaths associated with the virus. We are still seeing increased sporadic cases, meaning we can't identify a known source for the virus. The virus spreads stealthily because people can be infected without seeing symptoms for several days. That is why it's so important to continue taking the precautions we've been recommending since the onset of the pandemic. Keep your physical distance, limit and reduce the size of your gatherings, wear a mask or face covering, wash your hands, and stay home if you're sick.
We know that many of you at home pay close attention to how we track and report our COVID-19 data. The Oregon Health Authority has been committed from the very beginning to comprehensively and transparently tell the story of COVID-19 in Oregon. We maintain numerous dashboards and reports that have evolved as the pandemic has unfolded. These include, to name just a few, a dashboard that indicates our daily cases, hospitalizations, and one of our newer dashboards, one that shows vaccine administration and distribution. We post information about outbreaks in schools, long-term care facilities, and other workplaces.
There are some other sources of data that you can find on our website. The COVID-19 Weekly Report, which breaks down the data into demographic and geographic trends. We recently added graphs to this weekly report so that the data are easier to read and to interpret. These new graphs include mini plots of data since the beginning of the pandemic and new plots that show data from the past 3 months. The COVID-19 Weekly Outbreak Report shows outbreaks in workplaces, daycare centers, long-term care facilities, and other congregate settings. The Outbreak Report also provides information on COVID-19 cases associated with schools with in-person instruction. Here is our vaccine page that provides information on doses given, supplies received, and demographic trends. Here is a slide of our new daily update, which shows the number of newly reported cases, a 7-day moving average, and information on testing and percent positivity. This dashboard makes it easier to visualize the information we report in our daily press release. It is important to note, though, that the graph shown on this dashboard displays different data than in the Epi curve, which we've been producing since the beginning of the pandemic. This graph shows the number of new cases reported by the day that they became known to public health, whereas the EpiCurve graph shows the number of cases by their onset date. And these dashboards are downloadable. So if you wanted to download data, you can click on the Summary tab table in the Summary tab button in the upper right-hand corner.
And just as the virus doesn't stop at our borders, neither does our data analysis. We examine the data we post on our website and other data in Oregon, and we use guidance from the CDC, as well as lessons learned in other states and the available science to make our recommendations. We've changed our data practices to meet emerging trends. One example is shifting from a person-based system of testing reporting to a test-based system. This was done so that we can count all the COVID-19 tests a person may receive and provide a better picture of how COVID-19 is spreading in Oregon. The changes to our data collection and guidance can feel confusing at times, but these are the result of what we're learning and responding to and new lessons learned from the data. It's a normal part of the process in our response.
We've seen some recent social media discussion about our COVID-19 data submission form. This is an accessible way for providers and laboratories and other facilities to submit COVID-19 data through a secure platform. The data are reviewed by local public health departments, and based on the submitted information, either a new case is created or the data are linked to an existing case in our database. All new cases are interviewed by local public health departments, and any that are erroneously reported would be identified upon interview and removed from the case database.
And before we go to our questions, I want to tackle another commonly asked question, our reporting of COVID-19 related deaths. The wording I used is very intentional. To report COVID-19 deaths accurately, OHA relies on information from numerous sources, laboratories, health systems, local public health authorities, and information included on death certificates. Sometimes the death may not seem related to COVID-19, but our goal is to track all those who died with COVID-19. This is a standard practice in infectious disease reporting. Now we're ready for your questions. We want to make sure we can get to as many of your data questions as possible, so we'll only be taking questions on the topic of data today.
Thank you. The first question is from Janet. Why don't you report data for how many people have recovered from COVID-19?
Thank you, Janet. I'll take that question. We report, early in the pandemic, we were interviewing people weekly to assess whether or not they recovered. This is a very doable task when there were small numbers of people in Oregon who had the disease. As we've learned more about the disease, we know that most people recover and some may never even have symptoms. But it's important to learn about the course of disease in people. And so we do this in a very systematic way. For patients in the Portland metro area across the 3 counties who are hospitalized with COVID-19, we have specialists who do extensive chart reviews to determine what types of symptoms they had, other conditions associated with their illness, and to assess how long it takes them to recover, how long they were in the hospital, and other facts. We take this data that we collect in a systematic way, and along with 13 other communities and states, we bring this information to the CDC so we can better learn about the path of illness in people who have COVID-19 across the United States. And that's something we couldn't do just looking at data from here in Oregon.
Great. Next question is from Ross. Why aren't we seeing data being reported for flu?
I can take this question. This is Lex. So we do publish, or I should say the Acute and Communicable Disease Prevention Program publishes data on flu weekly in the form of a weekly Flu Bites. That Flu Bites document is posted to our website and can be found on the website. So for this season so far, we have seen that flu is decreased.
Thank you. Next question is from Carrie. Why do you focus on cumulative cases instead of active cases?
Thank you, Carrie. I think there's a lot of interest in how the COVID-19 has impacted Oregon and Oregonians since it began here about a year ago. So our primary data does focus on all cases or cumulative cases. but in making decisions and assessing how we are doing, we are looking at the most recent cases, active cases. We pull data looking at the last 2 weeks, and adding trend data to the weekly report are two ways we look at recent data. And by looking at that data and how cases are spreading in counties throughout Oregon and in the most recent period, it's a reminder that we all need to continue to take actions to protect ourselves, as Lex had mentioned earlier. We need to wear a mask and limit our gatherings and keep our distance.
The next question is for you, Dr. Sidelinger. It's from Landon. Why not open gyms? What data supports keeping them closed?
I go back to a comment I said earlier. When we look at our data, when we look at the evidence, that doesn't stop at the border. So we use multiple things in deciding the limitations that happen in counties with the highest spread. So currently in counties that are extreme risk, those with the highest rate of case spread in the last 2 weeks, we do not allow indoor fitness activities. That's because when people go to the gym, when they go to work out, they do so to try and get exercise. When people exercise, they breathe heavier, and it's easier for them to spread the disease further and makes it more transmissible. Even if we wear our masks while we're exercising, which is the recommendation, the requirement here in Oregon, when that mask gets damp as we sweat, it becomes less effective at preventing, blocking the virus from spreading. Those two things in a closed indoor environment make it easy to spread the virus. And we've seen multiple outbreaks in gyms across the country and across the world, primarily associated with group fitness classes in indoor settings, because we know those settings where people are working out inside without masks or with damp masks, it facilitates the spread of disease. We have seen limited spread of COVID-19 in fitness facilities in Oregon. Part of that is because those activities have been curtailed during some of the highest spread times here in Oregon, and also because there's a limitation to tracking a disease that people have without symptoms. And so we can't always trace back the exposure of people to where they got sick. During the initial part of our pandemic, about a third of our cases, we don't know how they got sick. And during the surge, that number has risen to about a half. So those highest risk settings, like gyms and fitness facilities, where we know the data shows us that the virus can travel fairly easily, we do limit those activities in counties with the most spread.
Thank you. Next question is from Yvonne. Why don't we know where the sporadic cases are coming from? Are they really untraceable?
I can go ahead and take that one. So these sporadic cases are cases that we haven't been able to identify a source. So those people who are not sporadic cases are either linked to an outbreak, they're linked to a close contact, or they're linked to a household member who all have had COVID-19 before that person had COVID-19. Those people are all linked to source because we know that their likely source of transmission is either from their loved one in their household or from, for example, a coworker in an outbreak. The sporadic cases are people where we can't find a link like those who are part of outbreaks or who have a household member that's sick. And so, yes, these cases who are considered sporadic are not traceable because we have not been able to find a known link to link that person to another case or to another exposure.
Thank you, Brad. Next question is from Brad. Do you release the results of contact tracing?
Thank you, Brad. I'll take that question. The data that we have that's regularly updated on contact tracing is on that first part of our public health investigation. How well have we been doing at reaching out to cases who are infected in a timely fashion? So on our public health indicators dashboard, we do report the timeliness of initiation of that first contact. That is the first step in contact tracing. We contact the person who's sick. We try to identify where they were before they potentially became sick and where they were in the days leading up to their symptom development or their lab test and in the days following to see where they may have exposed others. During the time of increasing cases, contact tracing in and of itself cannot track down every person who is exposed and get them to quarantine because there are many people out there who don't have symptoms. So we focus during this time of increased cases on those people who've had exposures in some of the most high-risk settings, if they work in a congregate care facility, work in another crowded setting, or other places where vulnerable individuals might have been exposed, and work with them to notify their family members and close friends that they may have had contact with, with instructions on how to quarantine at home. So that initial step of contact tracing, that timeliness of our initiation of contact with people, is posted on our public health indicators dashboard. And that timeliness has suffered during this time of increased cases. But we hope as people continue to take the actions to prevent the spread of disease, that we'll see our cases come back down again, and that number will come back up.
Next question is from Martha. I heard that data is behind a week. Is this true?
Thanks, Martha, for asking the question. So the data that we post there's a lot of data that we post that's updated on a daily basis. So all of our Tableau dashboards are updated Monday through Friday, and those provide data that's up to date as of midnight on the day before, or specifically 12:01 on the day before. And so for today's update, we'll be updating Tableau dashboards with yesterday's data. Our weekly reports, like the weekly outbreak report and the weekly data report, are posted on Wednesdays, and that provides data up until the past full week. And so for the data that's posted today, the reports that are posted today, they provide information up until Sunday of this past week. We also have information like the risk metrics and the school metrics. Those data are posted weekly as well, and they provide information up to the most recent week as well. Those data are a bit different because we provide data on a 2-week rolling basis, meaning that we provide data in 2-week chunks, and there's a 1-week overlap with every new week. So data are usually not a week behind. However, the data that you're looking at may be from the most recent week where there's a full week.
Alexander asks, is Oregon testing for SARS-CoV-2 variants like those found in the United Kingdom or South Africa? If so, have those variants been seen in Oregon?
Let me start by saying that we haven't seen those variants yet in Oregon, but that doesn't mean they're not here. I think we have to assume with what we know about the variant that it's easier to spread and that it's been seen in multiple states here in the United States, that is likely in Oregon. But the good news is the same measures that protect you from other variants of COVID-19 will protect you from this new variant: wearing your mask, avoiding crowds, and keeping your distance from others. We have 3 academic labs in Oregon that are currently sequencing for COVID-19, including our partners at OHSU, the University of Oregon, and Oregon State University. Our own Oregon State Public Health Laboratory expects to finish their validation of COVID-19 sequencing in the coming month. And so they will be able to look for that as well. We've been communicating with our laboratory partners about this potential variant being in Oregon. And we know that one of the kits that currently tests for COVID-19 can pick up one of the dropouts from that. And so we're asking labs if they see that dropout in the labs that they're doing on the regular PCR tests, that they consider sending those tests in for sequencing. So we'll continue to look for that strain, but we need to act like it's here and take those precautions all the time.
Next question is from Alfonso. What are the most affected counties in Oregon, and where can I find that information in Spanish?
Lex, we can't hear you.
I muted myself. Sorry about that, rookie mistake. So there is a dashboard that's on our healthoregon.org website that provides the cumulative rates of COVID-19 cases by counties. And so that however, is not translated into Spanish because that's on our Tableau website. And so that is a great point, and we can take that. I can take that back to my team, and we can work on translating some additional materials into Spanish and make it more accessible for all.
Bernadette asks, are positive tests for one individual reported multiple times?
Thank you, Bernadette. this is where we have a little difference between our reporting on cases and a reporting on percent positivity in laboratory tests. For an individual who tests positive for COVID-19, they are considered to have COVID-19, and we report them as one of our new cases when we become aware of that information. What we know about the spread of COVID-19 is it's very unlikely that they can be reinfected in the 3 months following their infection. So if they test again, even if they test positive, we're going to link that laboratory result to their existing case and not count them again. If it's been 6 months since they tested positive, we will create a new case for that person, and we will report that person as 2 cases separated by 6 months. So for our positive cases, we link them to our positive lab tests, we link them to people, and we report them in that fashion. But in reporting percent positivity, we just look at the tests done in a given week. We take all of the tests that were reported to us through electronic laboratory reports, which is about 90% of the tests done in Oregon. And then the numerator is the number of tests that were positive over that full number of tests. And that's how we estimate our testing for the week. And that's how we estimate the percent positivity each week. So an individual who tests positive twice in 1 week would be counted, that test would be counted twice in that piece. But we do create cases just based on individuals, not based on tests. So that's a little bit behind what you were asking, Bernadette.
Laura asks, is there a data page on the OHA site that shows how far away any given county is from meeting the criteria for the next level of allowable commerce?
Thanks. Yeah, so there is a map that shows the current risk level of each county. And if you hover over that map and over each county, it shows the most recent data associated with that county that puts them into that risk level. You can also find more information on the data that runs the current map on our website, and it is underneath the risk levels data, the metrics data that provides both the risk levels data and the school metrics data. The way that we calculate the rates, the case rates that allows people to, or counties to be in one risk level or the other, is based off of the 2019 Portland State University population estimates. And so that is how we use, so we use that information plus the case count data to calculate the case rate data. We don't have a place specifically on our website that shows that, for example, Multnomah County needs such and such many cases in order to move back down to a risk level or up to a risk level, but we do provide the risk categories, and that can be calculated.
And let me add a little bit to what Lex just said. You know, we do look at different data or look at data differently across different size counties. Mm-hmm. We know that in an ideal world, we want to correct the number of cases for the number of people in an area. So we use a case rate, the number of cases per 100,000 people. We use that for counties with over 30,000 people. But we know as counties' populations go down, that rate can really be affected by a cluster of cases or an outbreak because there's so few people in the county. So for those counties with populations under 30,000, we just look at the number of cases. That number of cases is actually higher than it would be if we used a case rate. But that's because in those smaller population counties, the population is often more spread out. So it's less easy to spread across an entire community very quickly. A similar reason is why we use percent positivity as another data point in our largest counties, those over 15,000. But in a very small county, for example, with 12 or 1,500 people, there's only so much testing that can be done. And so that percent positivity can often vary greatly with a couple of positive cases. So while that data is still reported, it's not used in making decisions to move a county from one risk level to another, but we work with our public health and healthcare partners to ensure that there's adequate testing and that they have the testing supplies they need to test people appropriately who have symptoms or exposures or concerns about COVID-19.
Next question is from Chris. Why does the map of cases by zip code omit Warm Springs?
I can take this one. So that map, that's by zip codes, actually does provide case counts for the zip code that is part of Warm Springs. What we don't do, though, however, is report the total number of cases by tribal affiliation. So it may be a bit difficult to assess that data because of the way that the Tableau map is created, but the data are there. You just have to drill down specifically to that one zip code in that region that you're looking for.
Question from Alexander. Do you have any data on the false positive rate for the PCR testing done in the state?
Thank you for that question. I think it is very rare for us to see a false positive test using PCR. A PCR test looks for genetic material, in this case, from the virus that causes COVID-19. It is very sensitive. It's very accurate. It picks up even very small amounts of that data. So it would be, it's not very likely in Oregon or in other communities to see a false positive, meaning the test says someone has COVID-19 when they don't. What is much more common is a false negative. The test may not identify the virus, and the person, is told they have a negative test, but that doesn't mean they don't have COVID-19. With many of our tests, there's still about a 30% chance that that person has COVID-19. So someone with symptoms or someone who's had an exposure, we do still ask them to take precautions and act like they may have COVID-19, even in the face of a negative test, if they have the appropriate symptoms and exposure. But false positives are very rare here in Oregon and in other communities that are using PCR to identify and diagnose COVID-19.
I can add to that a little bit. That is also not the false positive, but the false negative is also the reason why we do count both confirmed cases and presumptive cases here in Oregon. Presumptive cases are people who have COVID-19-like symptoms and they have known exposure to someone who has tested positive or a confirmed case. And so we not all the time do people who are presumptive test positive. They may test negative for reasons that Dr. Sidelinger just mentioned, or they may not be tested. But because they do have symptoms that are COVID-19 related, and because we do know that they have a known exposure, we do count them as a case of COVID-19 here in Oregon. Every week in the weekly report, we provide the proportion of cases that are presumptive cases, and we hover around 4.5% to 5% weekly.
Thank you. That's the last question.
So thank you all for joining us, and I know there's been a lot of interest in our data. We'll continue to post our data, try and update our visualizations with new ways of looking at our data, present some information on trends that we're seeing so that people can see a picture of what's happened in Oregon with COVID-19 since the virus first appeared here, but more importantly, what's happening in your community now so that you can appropriately take action. But some actions you should be taking all the time is wearing your mask when you're outside your home, limiting your gatherings and keeping your distance. The vaccine is here in Oregon. Some of you may have already received it because you're in that first priority group. For others, it will be coming. So that's our sign that things will get better here in 2021. We need to continue to work together and be proud of the efforts we've done to prevent the transmission of COVID-19 here in Oregon. We have one of the lowest case rates, one of the lowest fatality rates from COVID-19 of any state in the country. And that's because of the actions that all of you have taken to protect yourselves, your families, and your loved ones. So keep up the great work and happy 2021, everyone.